Well, it is my pleasure to open up this program this evening. My name is Dr. Stephanie Myers, and I am the National Co-Chair of Black Women for Positive Change. Black Women for Positive Change started out as Black Women for Obama in 2008. And after the president got reelected, we decided to stay together. And our initial mission was really to develop strategies to try to build wealth in our communities. We wanted to build pathways and ladders to the middle class and to financial strength. But as we organized ourselves, Trayvon Martin got killed, and everybody in the whole country started to relate a little closer to what was going on with violence. And we realized we can't build a strong community if our children and our families are at risk from violence. So we created a goal to change the culture of violence. We started off with a summit on nonviolence in 2012, which was a one-day activity. Several years later, we started to develop a week of nonviolence. We did that for a while. Now we're in our 10th year and it's a month of nonviolence. So October 1st to the 31st will be the 10th annual activity where we focus on nonviolence as a select issue. We're calling it the month of families, nonviolence, and opportunities, because we say that violence starts at the kitchen table. And so we're addressing the issue of the role families play and the anger and all that goes on. We're also focusing on nonviolence. One of our members was very close to Dr. Martin Luther King's wife. And so we have that as a philosophy. But the third element of our approach is really opportunities as alternatives to violence. And the young people that we've been working with, our Gen Zs and our millennials, they have told us they're violent because older people aren't giving them any dreams. They don't see a future. And they feel as though the boomer generation and the X generation is so self-absorbed with their own agenda, they're not taking the time to help them. So we're very pleased this evening to have this dialogue with Dr. Hill and with the Alzheimer's Association, because we know there's so many elements that contribute to violence and anger and poor communication and mistrust and all these kinds of things. So tonight we are looking forward to having that conversation. For those of you who are our guests, please put your email and information in our chat room. I invite you to come to our website, Black Women for Positive Change. You can join. We're multicultural. We have members who are white and Black and Asian and everything else. We have women and men. Our men are called our good brothers. My husband's the original good brother, and we have a whole network of good brothers. Henry Joseph, who's sitting here smiling, is one of our good brothers. And the men's network is very important to what we do. And we have the different generations. So with that, we invite you to come to our website and also come to our monthofnonviolence.org website and sign up, because our activities in October are going to be excellent. We have workshops on de-escalation. Diane Powell is doing one on domestic violence and intimate partner violence. At the end of October, we have a session on a youth summit and a youth concert. And if you have any young folks that would like to perform, as long as they're not cursing and talking violently, we're inviting them to perform so we can give them some visibility. So please join the month of nonviolence. And with that, I'd like to thank you all for being here, and particularly having the Alzheimer's Association. And now I would like to introduce the executive director of the Greater Pennsylvania chapter, and that is Mr. Clay Jacobs. And Mr. Jacobs will introduce Diane Powell, who is our chair for the Pittsburgh Black Women for Positive Change, and Ms. Powell will introduce Dr. Hill. Okay, Mr. Jacobs, please tell us about the association.
Thank you, Dr. Myers. And it's a privilege to be with everyone tonight. And ultimately, well, the variety of services and supports we provide at the association, only a chapter, but nationwide, is around how do we help families dealing with this journey from diagnosis to late stage care. But fundamentally, our work is about community, because that's what Alzheimer's affects. The community around people living with the diagnosis. That can be their workplace, their neighborhood, social groups, their faith community. There's so many ways to look at it, but from the first onset of symptoms to the later stages of care, everyone is impacted. So part of our work is to make sure we're listening and building solutions that make a difference at a community level, because ultimately we know that means far too many folks in our community are dealing with this today, and even more will in the future. And that's why I'm humbled to be with you this evening and to join so many of the amazing people who have already spoken and who will speak later about some of the efforts currently underway, and overall how there are opportunities for us all to make a difference. There's a quote from the late John Lewis that I love, and I use it all the time because I think it's that impactful. Firecrackers go off in a flash, then leave nothing but ashes. But I prefer a pilot light. The flame isn't always flashy, but once it's lit, it doesn't go out. It burns steadily and it burns forever. And as we start today, it's what I've seen from Diane Powell and all the Black Women for Positive Change in Pittsburgh, others like Michelle Tedder and Jacqueline Rupel, Darcel Madkins, who joins us, folks who are working to enact change where they live. They ignite something which I know will make a difference for so many impacted by this disease, and will hopefully truly shine a light on all the ways we can make a difference. And so I want to thank them, but also want to thank each of you for coming together on this important topic this evening, as well as to thank Dr. Carl Hill, who will be joining us in a little bit here. But with that, it is my pleasure to actually turn things over to Diane Powell to speak a little bit further and then introduce this evening's speaker. Thank you again, everyone.
Thank you, Mr. Jacobs. Thank you for joining us.
Thank you, Clay, and welcome everyone. I'm so appreciative of your participation this evening. We're going to talk about all things Alzheimer's disease, and that's a very difficult topic to tackle. But it is one that, from my perspective, it's imperative that we do so, particularly people of color. We hope, it is our goal and intention to provide some answers to this difficult disease that is really impacting communities of color. When you really look at the Alzheimer's disease and the numbers of people that it has affected, it has really exposed the depth of racial and health equity disparities within the African American community. And it essentially is a disease that we as a community cannot afford to turn a blind eye to. So despite its difficulty, if you look to your left and right, 9 times out of 10, the person next to you knows someone or can identify a relative, loved one, spouse, someone in their family is demonstrating signs of dementia and Alzheimer's. It's all around us. And it is our goal and intention to really begin to address some of the inequities and begin to help provide some information to help not only the victims, but the caregivers. So with that, it is my pleasure to introduce to you Dr. Carl Hill. He is the Chief Diversity, Equity, and Inclusion Officer for the Alzheimer's Association. And basically, he oversees the strategic initiatives to strengthen the association's outreach to all populations and provide communities with resources and support to address the Alzheimer's crisis. In this role, Dr. Hill is responsible for developing cross-functional partnerships with organizations to advance diversity, equity, and inclusion. And essentially, that's where Black Women for Positive Change came into the picture. The Alzheimer's Foundation reached out to us and asked that we partner with them to help spread the information about the disease and connect with the African American community. But I digress. As a result of Dr. Hill's leadership, the association has broadened its reach to previously diverse communities with partners such as the African Methodist Episcopal Church and the Buddhist Foundation. Within the association itself, Dr. Hill collaborates with human resources to attract talent and develop resources that champion staff diversity and a culture of inclusion. He is an author and has an editorial in the Journal of the American Medical Association Neurology, highlighting the need for more diverse perspectives to address disparities and pursue equity in dementia science. Previously, Dr. Hill served as the association's vice president, scientific engagement. And prior to joining the association, he served as director in the Office of Special Populations at the National Institutes on Aging. Throughout Dr. Hill's 6 years in this role, he had the development of the NIA Health Disparities Research Framework, which stimulates studies focused on health disparities related to aging. He also directed the NIA Butler Williams Scholars Program, which provides yearly training for early career investigators interested in aging research. Dr. Hill earned his PhD from the University of Michigan School of Public Health, where he trained with the Center for Research on Ethnicity, Culture, and Health, and the Program for Research on Black Americans. He is an alumnus of the National Medical Fellowships Incorporated, W.K. Kellogg Foundation Health Policy Fellowship Program. He holds a master's degree in public health from Morehouse School of Medicine, and he received the Distinguished Alumnus Award in 2019.
Okay, very good.
Yes. As a member of the Centers for Disease Control and Prevention, Public Health Prevention Service, a training and leadership program, he helped to establish the Center for Bioethics in Research and Healthcare at Tuskegee University. Please join us in welcoming Dr. Carl Hill.
Oh, thank you so much, Diane Powell. And I tell you, if I had gotten to that bio, I would have cut it in half because we've got such a great opportunity to engage with each other. And I think that's the most important part. So thank you for inviting me, Dr. Myers, and certainly my colleagues with the Alzheimer's Association, Clay Jacobs and Sarah Murphy and Matthew Sosa, who's on. Just really excited about this chance to talk a little bit about Alzheimer's and other dementia, and level set, I think, about what those are, what that means, and move into some discussion around disparities and diversity, and the association's real pursuit of equity. Really talking a bit about equity for dementia. So I'd like to share my slides here and take a minute to do that. That's always the transition in this space, and I'll see if I can successfully make that happen. Okay. Okay, all right. So today's title, as I came to know it, was the urgency, and it is an urgency of understanding Alzheimer's and its impact on individuals, families, and communities of color. Really excited about being here with the Black Women for Positive Change. As Clay mentioned, the Alzheimer's Association, thank you for your partnership with us, because we're just a wonderful organization with a vision of a world without Alzheimer's and all other dementia, right? And that all other dementia is so important. And we'll talk about that through the course of this quick presentation. I think I have about 15 minutes, so we'll hit the high notes and look for a good discussion. But that vision, really called me to this organization and a mission, where, we lead the way, to end Alzheimer's and other dementia, as Clay said, by accelerating global research, driving risk reduction and early detection, and then maximizing the delivery of care and support, right? And that's really critical. So we work on I work on a national level. Clay and Sarah and Matthew work, there locally to provide care and support. We're the largest nonprofit funder of Alzheimer's research. I'll say that again, the largest nonprofit funder of Alzheimer's research in the world. where we're committed to advancing research on treatment, prevention, that will ultimately, hopefully find a cure, right? And then third and really important, Dr. Myers, this is something I know you'll understand, as a federal employee, the word advocacy, was a bad word, So I'm so excited to be a part of an organization where we can legally, be the leading voice for Alzheimer's advocacy, fighting for critical resources, at federal and state levels, so that we can implement some of these innovative ideas, right? And so when you see that symbol there, it's I'm sure you've seen that on TV or on billboards and on buses in your city. It's that Florence flask, which represents science, and how that translates into protecting and improving people's health and the health of caregivers. And so really translating into information and resources, key word here, resources that people can use, right? Really, really intriguing. So the association is a global organization in 3 areas: working to advance care, and advocacy and support research across the world. And it gets me so excited to think about the opportunity that we have with the Alzheimer's Association. Now, just level setting, we've used these words interchangeably: Alzheimer's, dementia. Alzheimer's is a type of dementia, right? It is a cause of dementia, right? So dementia is a collection of symptoms related to cognitive decline, right? We'll define that, but that has to do with memory, right? So decline in memory could include behavioral, psychological, cognitive symptoms. It's due to biological changes in the brain, not simply growing older or becoming higher in age, but it's due to biological changes in the brain. Those changes are, the growth of amyloid, which is a protein, tau, which is a protein, and then the neurodegeneration, or the killing of the cells in the brain that causes plaques and tangles, which really lead to these psychological and cognitive problems, right? And so biological changes in the brain. As I mentioned, Alzheimer's is the most common cause, attributing you can attribute 60 to 80% of all dementia to Alzheimer's, right? But what's intriguing is that there are other types, right? So there's Lewy body dementia, which is caused by a different protein, alpha-synuclein; frontal temporal, which is located at the front part of the brain; and then vascular dementia. And I want you to put a pin in vascular dementia as we talk a bit about disparities, because it's caused by blood that has been damaged because of vascular issues along the life course, right? And so stroke, hypertension, diabetes, chronic poor vascular health over the life course has some influence on a risk for dementia later in life, right? So really intriguing, because we know that there's some stark disparities in many of those vascular conditions that I just named, right? So put a pin in vascular dementia, because I think it's going to be quite relevant to our discussion. We also know, and if you've been following the news, you know that the first disease-modifying treatment for Alzheimer's has been approved by FDA. It's called aducanumab, and it better known as Aduhelm, and it was produced by the company Biogen, right? And so, that particular drug, has met some controversy because of its efficacy, and there's some other questions around inclusion. We'll talk about those in a little bit. So, that particular company Biogen will have, I think it's 9 years to do follow-up clinical trials testing to establish greater efficacy. We know access is going to be an issue, so these things are very important. But while they work all of that out, and while we work to understand how to give people access, we do know that dementia occurs along a continuum of cognitive impairment, right? So it really gives us an opportunity to think about this from a public health or maybe even a behavioral perspective, right? So here, look at this slide here. Cognitive impairment can be defined as impairment in 2 or more cognitive functions that interfere with activities of daily living, right? And so what we know is that everyone who develops dementia passes through mild cognitive impairment, right? Really intriguing. So, from the work that Clay mentioned, community-based, giving people education and awareness about this devastating dementia, various types of dementia, we know that if we're able to prevent new cases of MCI, mild cognitive impairment, or delay, this continuum, that we have a real chance of preventing new cases of severe or even delaying new cases of dementia, right? And so this continuum is even in play with that drug Aduhelm, right? Because what Biogen found was that people who received the infusion, the drug, that there was a slowing of this continuum, right? There was a slowing of this continuum, right? And so really intriguing. And there are some things as we think of, we talked about the vascular dementia. If you can get a diagnosis, then your doctor might be able to put you or your loved one on a patient management plan, which could slow this continuum, right? So there's some real opportunities here for us to get this word out, right, about this continuum and the things that we all could do potentially to slow this continuum. Why is all of this important? Well, Alzheimer's and other dementia is a public health priority, right? And so this is data from our 2021 Facts and Figures report. Great report where you can see statistics related to all things Alzheimer's and dementia. You can find that at alz.org/facts. Great report, free of charge. But just a few months ago, they reported in that document that more than 6 million Americans aged 65 years and older are living with Alzheimer's. That number is expected to more than double by 2050, right? And so, Dr. Myers and I were talking about COVID-19 and how that influences Alzheimer's. Well, it's hitting people with Alzheimer's hard, right? There are 42,000 more deaths in 2020 than expected. That's a 16% increase, right? And again, we put a pin in vascular dementia. Think about those comorbid conditions, those chronic conditions that have found to be related to COVID-19 infection and ultimately those that unfortunately succumb to COVID-19, diabetes, hypertension, history of stroke, right? And so those same conditions, right, are relevant for Alzheimer's and dementia risk as well, right? So we're seeing some patterning as they relate to Alzheimer's death as well. And then finally, disease-related costs continue to rise. So in 2021, Alzheimer's cost the country $355 billion, and that's up 50 billion from 2020, right? So however you think about this from a prevalence perspective or the phenomena, COVID-19, which we're dealing with right now, or health economics perspective, Alzheimer's and other dementia is a public health priority that we have to pay immediate close attention to. In that space, there are disparities, right? So in a situation where we're all pivoting and trying to understand the impact of Alzheimer's and other dementia, there are populations and communities that are disproportionately affected. Almost 2/3 of Americans with Alzheimer's are women. That's especially relevant for the Black Women for Positive Change, right? Women. Older Black and Hispanic Americans are more likely than older whites to have Alzheimer's or other dementias. That's really important. Older Black, the African American community, is 2 times more likely to have dementia than whites, right? Really interesting, right? So if you put the first 2 bullets together, and you know that African American women live longer than Black men, then you know that Black women are caregivers and are more likely to develop this devastating Alzheimer's and other dementia. So this is very relevant for the work that you do. Third bullet, when you think about those, so when you hear that those disparities, you say, now what could be some of the factors, right? And so we talked a little bit about some of those morbidities that could be at play: stroke, diabetes, those things that are related to poor vascular health, right? So some are maybe fundamental and some are unique, right? And so when we think about what are fundamental, I certainly, what first comes to mind is being able to see a neurologist, being able to see a doctor, right? So you can get a what? Timely diagnosis. Because if you can get a diagnosis, you can what? Maybe slow that continuum down. So in order to get a timely diagnosis and maybe slow that continuum, it's important to know where a neurologist is, and also to know maybe the 10 warning signs, which you can find on alz.org. But those are important resources that the Alzheimer's Association provides to communities, and we're looking to engage with more communities with those resources, right? But think about the disparities and a constellation of factors that could be fundamental and that could be unique, and we'll focus on the Black African American community during today's talk. Now, when we talk about unique factors in that constellation, there was a tremendous special report that was released alongside that facts and figures report, focused on race, ethnicity, and Alzheimer's in America. This is the most comprehensive data that I have seen that includes representation and responses from American Indian, Alaska Native, or Native Americans, Asian Americans, Hispanic, Latino responded. So some real interesting findings as they pertain to Alzheimer's and race and ethnicity in America. So, and we think about those unique factors, right? So we talked about being able, having access to a neurologist, to a doctor. That's fundamental, so you can get a timely diagnosis. Well, in this report, more than 1/3 of Black Americans and nearly 1/5 of Hispanic and Asian Americans believe that discrimination would be a barrier to receiving Alzheimer's care, right? And the number one reason that they thought would be the case for that discrimination was that they would be treated differently because of their race, color, or ethnicity, right? Really interesting, right? So when we think about some of the upstream factors that Dr. Myers was talking about in terms of violence, and not only viewing this as a behavioral response, but the context of stress and opportunity and how all that creates a pathway for behavior. Think about going to see a neurologist as a behavior, or if you're a caregiver and you're thinking about taking your loved one to see a neurologist, if that behavior, if that decision was somehow impacted or influenced by your perception of that you would be treated unfairly because you're Black or African American, right? Really, really interesting results, right? And so when we think about these disparities, it's important that we understand those factors that occur in the environment, right? And I put as an environmental factor access to healthcare, access to quality healthcare. So not just any neurologist, but one that will take the time to listen and provide care with cultural competence and maybe even humility, right? Really important to provide quality care. How that links to cultural factors, right? So that discrimination is a cultural factor, or the how people are thinking about the vaccine. Think about COVID-19 and all of the reasons why the people who are not vaccinated have, for not getting that vaccine. We have to understand that so that we can address that, and how all of that kind of links with behavior, the behavior of seeking a timely diagnosis, the behavior of engaging in violence and other activities. But we have to understand the pathway and how ultimately that links to biological outcomes. In this case, the biology that we're interested in are those proteins, amyloid, tau, and how that leads to neurodegeneration. So are there unique pathways to dementia risk for at-risk communities? And I will argue that there are. There are things that we have to understand. Not every community, every population comes to risk in the same way, right? And we have to understand this by doing real important engagement and real important research in that way. Now, another, I think, fundamental factor for addressing these disparities is including African Americans in the research enterprise. You'll never get a chance to understand how to address the disparities or understand these pathways for dementia risk if we don't include a robust representation of all people in clinical trials. And unfortunately, less than 5% of clinical trial participants in Alzheimer's research are African American, Latino, Asian American, or American Indian, Alaska Native, right? So if you're following this, you're saying, okay, now the communities that are disproportionately affected, most at risk, right, are less likely to be included in the research, right? And then, here's backstory. When you participate in a clinical trial, you're probably going to see a neurologist at, some academic center, or you're going to, in some clinic. So the people that actually, go to see a neurologist, or they're thinking about it, the reason that they may not participate is because they think they'd be treated unfairly or discriminated against because of their race or ethnicity, right? So this I think creates a huge, opportunity for the work that we are looking to do in communities. And so from a diversity, equity, and inclusion perspective, we certainly promote multi-level health disparities research, where we're not focused only on biology or only on behavior, but context, right? And so some of those sociocultural factors, environmental factors, and how that all creates pathways, that's really important. We certainly advocate for diversity in health systems and health-related institutions, right? So that's building pipelines. I heard some conversation earlier about recruiting high school students and really going into that pipeline to institutions where we can hopefully get more inclusion in healthcare systems, where African Americans are working as neurologists, as researchers, as doctors and nurses and nurse practitioners. So we need more representation in these systems. Cultural competence, and maybe it's humility. It's not just competence. Sometimes people know what to do, they don't do it. So how do we get people to really, who will provide care, doctors and neurologists, to take the time to listen and provide quality care in that way? And then the last bullet here is participatory engagement to build trust and trustworthiness. And this is where we're really focused on our work in diversity, equity, and inclusion, is finding partnerships, working with organizations that will help us get into more of these underserved and disproportionately affected communities with this information about why it's important to get a timely diagnosis, or who are some good neurologists in your community that provide culturally competent care, right? Our chapters all around the country, our chapter there in Pittsburgh, it can certainly, in Pennsylvania, can certainly provide those resources for our communities. And we're really guided by the principles of community-based participatory research. And that takes a partnership approach, right? Equitable partnership, where we're working with community members, researchers, organizational representatives, right? Because we know that to build trust means that you've got to become trustworthy. And that is a process of engagement, so that individuals like my mom, she's 75 years old, living in Atlanta, Georgia, and she's probably going to participate in an activity if an organization that she belongs to endorses it, right? And so it's knowing that there's so many local and national organizations that can help us once we're able to engage and build that trust and to become trustworthy. Here are just a snapshot of some of our national partners. As was mentioned, Diane Powell mentioned, we have a great national partnership with the African Methodist Episcopal Church. This gives us an opportunity to work nationally, but also link churches, local AME churches, with our chapters around the country, right? So a real chance to develop that trust and organize those resources and deliver those to African American communities in the ways that they can receive them. Just a list of other partners here. SAGE advocates for LGBT elders. The Thurgood Marshall College Fund, it organizes the historically Black colleges and universities around the country. I finished Morehouse College, so that great opportunities to build that pipeline. We have an internship program with our chapters. And then my fraternity, Omega Psi Phi fraternity, chapters all over the country, right? So if we can begin to work with the Qs and to get them on board to help us deliver this information, we can make some impact, specifically with Black men and Alzheimer's and dementia, right? And so we're certainly thankful for your partnership in helping us to work with these organizations. And so ultimately, we're focusing, I'm coming to the end here, but we're focused on not just recounting the disparity. So diversity is taking account of who's here and which perspectives are missing is really important. But we've got to do more with intentional inclusion, thinking about those perspectives to risk. Also thinking about the ways that we can include underrepresented and disproportionately affected populations into clinical trials, into Alzheimer's research. That's fundamental. We've got to be a part of the research to be a part of the solution, right? Really important. And then all of this is really important from an equity perspective, different from equality, where every community gets the same amount of the same resource, right? And at one point, I would imagine equality was really important, right? And so no knock on equality, but we're moving to 2.0, and that's equity, where we can get a firm grasp of how people receive resources. What are the ways that we can communicate our resources so that people get it? And we think that these partnerships allow us that chance to deliver our resources in an equitable way. Really important. And so, I'll end where we began. And so you go all the way back to the beginnings of Alzheimer's research, really. And on the left there is Dr. Alois Alzheimer's, German researcher, early 1900s. He had a diverse perspective, if you will. And he said, the behavioral changes that he was observing among older adults was due more to biological changes in the brain than growing older, right? Provocative idea at that time, and so he assembled a staff of researchers, and he recruited an intentional inclusion of Dr. Solomon Carter Fuller there in the middle, who is the first known African-American psychiatrist in this country. He finished Livingstone College in North Carolina. That's an HBCU, still around today. And he finished there and went to medical school at Boston University, finished medical school in 1897, right? And because of some of the discrimination that was taking place in this country at that time, we've already talked about discrimination, still around today, but he was unable to pursue the research career that he intended. And so he was relegated to performing autopsies. Well, that's just what Dr. Alzheimer's needed for his lab. And he recruited him to Germany. And so Dr. Alzheimer's, this disease is named after him, Dr. Solomon Carter Fuller, Dr. Frank Louis, many other researchers. This team came together to identify what we know now are the hallmarks of Alzheimer's, and that's amyloid, tau, and neurodegeneration. So I would posit that diversity, equity, and inclusion have been hallmarks of this space from the very beginning, right? We have a legacy of thinking about diverse perspectives, being intentional in our inclusion, and doing all of this so that we can give people what they need. Really, really important. And that's the opportunity that we have before us with all of our partnerships and the one that we have with you, and we really appreciate that. So I'll leave you with this is our 1-800 number. My colleagues are available 24/7 to answer questions, or even if you have an idea of who we might partner with nationally, please call my colleagues at 800-272-3900. We'd love to hear from you. So thank you for listening.
Dr. Hill, we have a number of questions in the chat box. We'd like to take just a few minutes and hopefully you can address some of those questions.
Absolutely.
One is, why are Black people more likely to develop this and other diseases?
Yeah, that's a good question. And that's one that, we certainly can speculate around that pin we put in vascular dementia, and so we would speculate that there are severe disparities in diabetes and stroke and hypertension that don't favor African Americans, right? And so, in that, thinking about that life course perspective and those pathways, maybe it's because African Americans are more likely to have those comorbidities along the life course, and it puts them at increased risk for Alzheimer's or another dementia, right? But the real answer is we don't know, because there aren't many African Americans participating, or I'll put it another way, being recruited into the clinical trials, right? So I don't blame the victim here. It's not that these populations are hard to reach, or would rather not participate. We have to find innovative and creative ways to include the African American community into these clinical trials so that we can test some of these hypotheses and research questions.
Thank you. Another question is, how has the Alzheimer's Association incorporated an encouraging message to change thinking in the African American community as it relates to research and the need for research?
Yeah, no, I think this is our staple is partnership. Certainly taking a look within and being inclusive in who we recruit to work with the association and our chapters, and who serves on our chapter boards, our material. We've got so much print material, social media, and I tell you, when people see our material and it's not inclusive, they don't see anyone who looks like them, that's an immediate turn off, right? So we've got to make sure that our resources reflect the communities that we like to engage. But then, importantly, is using our partnerships. So once we're able to establish a partnership with the African Methodist Episcopal Church, or the Black Women for Positive Change, we can develop some of these resources and have our partners give us some feedback on whether this resonates. How can we alter this? How can we change this a bit so that it can be more relevant and effective, and make an impact, so that we can get people to see a neurologist when they need to, or know the 10 warning signs.
Thank you. That question is a perfect segue to my portion of the program, and I'll go quickly because I out of respect that for our two remaining panelists, Michelle Tedder and Jacqueline Rubel. But I wanted to just hit the key message that you emphasized, and that is the need of partnership. Black Women for Positive Change relies totally on volunteerism to do the work that we do. And in the same way, the Alzheimer's Association relies heavily on volunteers in terms of recruiting people to host education workshops, to educate the public on the disease, to just raise public awareness, and to connect people with services and resources, those individuals who are in need of support, particularly caregivers. So I just want to reinforce the idea that if any one of you who are listening to this message is interested in volunteering, please feel free to reach out to me. My email is in the chat box, as well as to Dr. Hill. If you have suggestions on organizations that we can contact who would be willing to host education workshops, please make us aware of that. I'd also like to emphasize that when Sarah Murphy from the Alzheimer's Foundation reached out to me, the two people that I reached out first was Alicia Scott from the Allegheny Health Network, and she's also vice chair of Chi Eta Phi nursing sorority. And I also reached out to Michelle Tedder, who's working with the Allegheny Community College. These are key community stakeholders, people who have an eye and ear for things that are happening in the community. So if
absolutely, Diane, we have a national partnership with Chi Eta Phi, so we're all working together. This is great. That's great, Diane Powell. Yep.
Chi Eta Phi and Black Women for Positive Change are your two newest partnerships. We hope to expand that nationally and to continue to recruit volunteers on the local level.
Absolutely.
So
thank you.
With that, I will introduce our next speaker, and that will be Jacqueline Rubel.
Hello, hi, I'm Jacqueline Rubel, and I'm coming here today to give my viewpoint on having a parent who has Alzheimer's. First, I want to let everyone know that I have doctorates in health administration. I'm a retired nurse practitioner, and I thought that my knowledge of medicine would help me to deal with the changes that was going on with my father. But time has shown that it does not. And it's as a child of someone who's going through Alzheimer's, regardless of your knowledge, which does help, you still are looking for resources and looking for ways to deal with the changes that are going on health-wise. My father became ill about 4 years ago. And though there were subtle changes prior to that, we noticed the changes initially, my mother and I, to him having physical changes and having mental changes. These changes came about, and I tried to make my mother aware of it. And with that knowledge, I was able to have her sign up with the research with the University of with the University of Pitt, and they were working outside of UPMC's hospitals. And we would go there at least once a year. They would assess him, see the changes that was going on. But it was difficult to initially get them there because of what Dr. Hill discussed. When they walked in, there were no African-American doctors, there were no African-American nurses. Most of the people that were enrolled in the study were people who were non-African Americans. So my father was very apprehensive about participating, but because I was there and he trusted me to make sure that he was taken care of, he remained in the study, and my mother also remained in the study with him. This helped a great deal because it allowed my mother to understand how Alzheimer's and Lewy bodies does affect the person's mental changes. But then when we try to relay this over to my siblings and other family relatives, it was hard for them to accept, they wanted to keep it in the family, not to tell anybody, we'll just deal with it. And that's the thing sometimes with our culture. There probably were people in our families who had this, but they were just awkward, or we can justify they just had a strange personality. But we must take and the initiative to try to reach out and get help, to encourage other African American physicians to to participate and bring in more African Americans into the research arena, so that we can feel more comfortable knowing that there's someone out there who's looking out for us. When this change came about, I try to keep my siblings and other family members aware of what was going on. And it was at first, it was my feelings were in it, and I because they were rejecting it. But then I had to step back and realize it's hard to accept that. But as time's gone on, they have realized with education, with other medical people giving them answering their questions, they have been able to work with my father, and we're able to make sure that the last times of his life are comfortable, and that we keep him engaged as much as possible. He is at home because of the COVID. My mother was worried that she wouldn't be able to see him. So we do have people coming into the home and helping with his care, but a lot of people aren't able to have that luxury of having in-home care. But it does cause isolation, and trying to get my mother to be outside of the home is something that, I'm trying to get her to work more with the Alzheimer's Society so that she can learn to reach out and get out of the home. And, these are things that the society is able to work with caregivers to give them that support. And, but just making sure that other family members and people in the African American community realize it's not that someone's trying to get into your business. they're not trying to take anybody away, but we're here to support them and to let them know that this care is available to them and that the research is not something that is going to cause harm, but to help prevent future, advances of this terrible disease. So that is something that I wanted to encourage other people who are online to make sure that they are getting that message out, that we as African Americans, we need to start not being afraid to accept medicine, accept research, and to accept the changes that are going on, and that we working toward preventing it, not trying to continue to cover it up. And that this is something that will be beneficial for future generations. And thank you for letting me speak. Have a good day.
Apple, and thank you for putting a face on the role of caregiving and the impact on caregivers. Our next speaker is Michelle Tedder from Allegheny Community College, and she will be followed by Sarah Murphy from the Alzheimer's Foundation. We'll do wrap up, and the remaining time will be for questions. Please go ahead, Michelle.
Thank you so much, Diane. And thank you so much, Jackie. You always share so intimately and passionately about your personal experience, and that's so appreciative. I think, as I was listening to Dr. Hill and I was listening to Jackie's story, and I was just taking some notes, and I thought the one word that kept jumping out at me is community. And when I think about community, first, I want to say thank you, Dr. Hill, for highlighting the CBPR approach, because the community-based participatory research approach, I think, is central and key to especially engaging with Black and Brown communities, because I think that there has to be some safety, right? It has to be a safe place. And so, we could probably go on and talk about why we feel unsafe. We don't have enough time for that tonight. But I think that really beginning to understand that if people are able to come to the table and have voice and understand and educate, right, around why it's important to participate so that we can be represented, as long as the research is done decently and in order, as we would say in church, that we can embrace that. But we need to be able to come to the table to have those kind of critical conversations in community in order to increase the access to people of color participating. And then when I think about community, as we're talking about how to engage and get the word out, what we're doing tonight is absolutely critical, but I think it's also critical for us to be able to share our networks one with another, both on the macro level as well as the micro level, in terms of sharing with our families that we were on this call tonight, sharing with people that we know who have this disease and saying, hey, there is help out there. I think for whatever reasons, we tend to carry a lot of shame and a lot of hiding. I think Jackie was highlighting, and we interpret that and say, well, I don't want anyone to know about my business. But the truth of the matter is, the best way that we learn and grow is in community. It's in connection with one another. It's in having that support with one another. So that's why it's important for those of us who understand and value the strength of community, that we do these things, but then we take it beyond and we share it within our networks. And then we encourage those networks to share it with their networks. And this is why we do the things that we do. And so the value of community engagement, strategic partnerships, and just taking a village approach to how we address all of these things that we are dealing with, because our communities are always hit hardest. We're living in a pandemic, and once again, we're hit hardest. So at some point, we've got to take a look and say, how do we unite? How do we share the connection? Because there's power in that. And actually, from a grassroots standpoint, we've always known how to connect, whether it was in church, whether it was, in the fields. If we want to take it all the way back there, we learned how to connect. So for such a time as this, it is very important for us to continue to connect, to have these forums, and then exponentially go out, teach one, tell one, pull people together. On that note, I'm going to go ahead and tell Sarah, take over.
Amen. I think you said it perfectly. When Diane said for me to do the closing, I know Michelle is always spot on. And I just, on behalf of the Alzheimer's Association, we've been honored, I think, at the Pittsburgh chapter here in Greater Pennsylvania to be so inspired to work with Black Women for Positive Change. When we approached in February, it was leveraging sphere of influence. And we really have been honored to work. Diane Powell has been amazing to work with. The individuals, Michelle and Alicia, who have come on, and Jacqueline, have really been able to empower us at the organization to connect into the community. And it has just been inspiring to work with these women. And we're looking forward to making connections and helping more people. Jacqueline, thank you so much for sharing your story. Dr. Myers, thank you for allowing this forum today to speak and address the urgency of Alzheimer's disease. It has been a true honor on behalf of the Alzheimer's Association, Clay Jacobs, myself, Matthew, who is joining us, Dr. Hill. It's an honor to have you as well. This is just the beginning. We're looking forward to continue this work. And at any time, wherever you can access us, the Alzheimer's Association is here. 24/7 or 24/7 helpline that we put in the chat. Dr. Hill had mentioned that as well in his presentation. But we are fortunate and honored to be here to work with you all. We're looking forward to attending the 10th anniversary event right here in Pittsburgh. So Dr. Myers, we're going to be there to support the Black Women for Positive Change and that movement. And so we're looking forward to great things to come. Dr. Hill, wanted to see if you had any last words or any last questions as we wrap up here.
No, just tremendously appreciative of the opportunity and the partnership, Sarah, and looking forward to all of the next steps and the great work that we can do together to not only partner, but to make impact in pursuing equity and addressing these disparities. I do think that there's work that we can do together to make an impact on those disparities and to do more to get more representation in Alzheimer's clinical trials and research. So thank you so much for the partnership. Yeah.
Well, thank you, Dr. Hill, and thanks to the entire organization. These were excellent presentations. Good job, Diane, and we appreciate the insights you provided. Dr. Hill, just one question that I have, and we may have a few others as we wrap up this session. You mentioned the clinical trials and how difficult it is to get African-American people to participate for a whole variety of reasons, and lack of trust in the government being one of those. Has anyone thought about incentives, ways to incentivize people to participate in the trials rather than just telling them this is the thing you should do because it's the right thing to do? We've seen people get incentives for taking vaccines in some states. They've actually been given money for taking vaccines. So I think we should open up the question and explore some other options. Have you considered that? Or
Absolutely, Dr. Myers. And I think, this always comes up, as it could potentially damage the rigor of the scientific project, right? Because you put yourself in a place where you might only be able to recruit those that would take the incentive, right? But I think there are ways of statistically controlling that. And so, that is not a proper response. I think this all links to a larger movement in this space, and it's the science of recruitment and retention. And that is, developing novel strategies and evaluating those and sharing them at national conferences like the Alzheimer's Association's International Conference, or the APHA, Dr. Myers, or many other conferences, but beginning to see recruitment as a science and evaluating these strategies and sharing them with the field. We know it's not a one size that fits all, but there's so much that researchers can learn from each other. That's two. And then three, quick point. Clay Jacobs put an act that's being considered by Congress right now, the ENACT Act, in the chat, and that'll provide resources for Alzheimer's disease research centers around the country to do more with this science of recruitment. So I think there's some change coming, and incentive, evaluating the strength of incentives is going to be one important question that we pursue moving forward.
Okay, thank you. And if we have just another few minutes, Diane, we can open it up for a few wrap up questions and
Can we do that? There are still some questions remaining in the chat box.
that's good, or perhaps we can give our participants an opportunity if they'd like to ask one personally, but go ahead and read what you have in the chat box.
Well, if you can open it up, let them ask themselves. I'm sure they'd like that.
Okay, do we have a question from our audience here that someone would like to ask a question? You can unmute yourself.
Hi, this is, excuse me, Georgia Dunston. I had a couple questions in the chat box. I was curious about the, thank you, first of all, thank you, Dr. Hill, for a very interesting, informative presentation. I was curious about the different stages of the dementia and types. I will not, this Louis, and then the other speaker actually spoke of Louis, and I wanted to confirm that her father actually was diagnosed with the Louis type, if I understood her correctly. And I was curious how the Lewy bodies differed from amyloid and the TAR proteins that's kind of conventionally that I'm familiar with associated. If you could comment there. And is the treatment, I was curious, is the treatment different based on the biology with regard to the amyloid and TAR and Lewy bodies? If you could clarify that for me.
Yes, really good question. And so that the symptoms, if you will, for Lewy body, linked to that alpha-synuclein protein, so it's not the amyloid, it's the alpha-synuclein. And that's where, Dr. Myers and I were talking earlier about aggression, and some different, I guess, behavioral, symptoms are associated with Lewy body dementia. So there are some differences, right, in between the different types of dementia from a biological perspective, and it really links to the treatment that the FDA approved, which is focused on, it's an antibody focused on amyloid, right? And so again, so it really gets to, your question is, we still have a ways to go for a pharmacologic treatment, that addresses all the different types of dementia. And then, kind of reading between the lines of my presentation, maybe vascular dementia is more relevant for the African American community, that of which we just don't know fully because we haven't had the type of recruitment necessarily, successful recruitment to really make that case, right? So there's so much more that we need to do. Excited about Aduhelm and the pathway for pharmacologic approval. The Alzheimer's Association advocates for anyone to have access to it, but we know that we need to do more to understand disparities and the impact on the Black community.
Excellent. And I'd like for our group to know that we were just listening to an exchange by two veterans of the National Institutes of Health, Dr. Hill and Dr. Dunston. Both have worked at the NIH for years, and Dr. Dunston's a human genome specialist and Dr. Hill's Alzheimer's. So ladies and gentlemen, we are fortunate to have some real scholars in the house. So thanks to both of you. Beautiful.
Dr. Dunston is a proud member of Black Women for Positive Change. We are
Absolutely.
honored to have her in our midst.
Yes, indeed.
Yes.
Yeah, I was telling Dr. Dunston, I was telling Dr. Myers, I started my career with the National Center at the time on minority health and health disparities with
John Ruffin. Yes.
And you're an Omega Sci-Fi, and we work closely with our Qs.
Absolutely.
We got lots of connections here.
Oh, we're in the community, Dr. Myers. We're in the community.
Right. That's right. Okay, let's go with two more questions and then we'll kind of wrap up. Does someone else have a question they'd like?
Yes, I have a question really fast. Dr. Hill, can you comment on any natural things that we can do, like the exercise or the eating, or what kind of natural, approaches can we take for prevention?
Yeah, no, it's a really good question, and you think about that slide where I put up with the continuum, right? And so, and we talked about those comorbidities, those vascular conditions, diabetes and hypertension, stroke, so there was one study, the Sprint Mind study, that had a real adequate, robust sample of African Americans. Really good study, Sprint Mind study, and it showed that getting systolic blood pressure down to 120 saw a decrease in mild cognitive impairment and dementia. So it slowed that continuum down, right? And so the Alzheimer's Association, took those results, and we are leading the U.S. Pointer trial that you can find information about Sprint Mind in the U.S. Pointer trial on our website, alz.org. But we're recruiting in 5 locations around the country, and we're taking a look at the recipe of physical activity, right? Because that's important for vascular health, cardiovascular health. Diet, so we're testing the Mediterranean diet, high in fruits and vegetables, low in saturated fats, and then support, being sure that people can have adequate support, which is important, right? Because people engage in behaviors, they need a certain level of support. So we want to understand what recipe of lifestyle factors, if you will, would be important for slowing that continuum down. So, so there are things that we can do related to the research is telling us more and more, related to diet and physical activity that are really important.
Blood pressure at 120.
120, systolic at 120. That's right.
Systolic at 120. Okay.
Yeah.
Wow. Okay. All right. Who has our wrap-up question for the evening?
I'd like to say thank you so much. It was very informative. My grandpa had Alzheimer's, my grandma had dementia. I myself, I'm a clinical safety scientist. I like Biogen Pharmaceutical, they're into diversity. I myself have multiple sclerosis. It was very hard for me to find a Black doctor to take care of MS. I've yet to find one, but I believe Biogen will help us a lot. I called them. As a state clinical safety scientist, I need help where I live at. I live in an urban area. You know what? They came to me. They talked to me and they helped me. So I think Biogen is the way to go. And thank you so much, doctor. You're very informative. As being a clinical safety scientist, we need more African Americans and Latinos participate in clinical safety. They think it's 1930 to ski. They're still scared to ski, but no way. We change. I'm very strict with my participants.
Thank you very much, Ms. Smith. Thank you.
You're welcome. Thank you.
Thank you, Ms. Smith.
Dr. Masarki, I believe he has his hand up, so that will be our wrap-up session. And yes, the recording will be available probably within a week. We will post it up on YouTube. On our YouTube channel is called Black Women for Positive Change Urgent Issues channel. And so Maria and Henry Joseph, our tech experts, will have it up, and we'll so just remember that. What did you say, Maria? Oh, okay. All right. Black Women for Positive Change Urgent Issues channel on YouTube. Okay, Dr. Masarski.
Not doctor, just plain old Ed Masarski.
Okay.
Thank you. I'm pretty aware of what Dr. Stephen Thomas was doing at the Center for Minority Health in Pittsburgh when he was there. Time has passed, and I'm wondering what is happening as far as the affiliation or association with the Graduate School of Public Health at the University of Pittsburgh and the School of Medicine. Do you have conversations going on with them to include folks in research?
Doctor, this is addressed to Dr. Hill.
Well,
Yeah, I can weigh in.
Okay.
I do know Dr. Thomas from some academic and research circles and his work in barbershops, and I think I saw some work where he was recruiting Black men to be vaccinated for COVID and using that same methodology. So I think this links into this science of recruitment. So I know Dr. Thomas during my time at NIA was interested in getting a grant to evaluate some recruitment strategies for clinical trial inclusion. So there's the one-off of giving a grant to one researcher, and then there's the creating a field where early career investigators and mentors like Dr. Thomas can help move this field forward so that we can have a robust, response to this, and many projects around the country giving us data and best practices. Yeah.
Okay, thank you. Well, thanks everyone for joining us. We invite you to become a part of Black Women for Positive Change. Our dues are incredibly reasonable, $75 a year. You won't find that anywhere else in the country. And if you do decide to sign up, men, women, whoever, you'll be notified of different events that we're having. And otherwise, it's a catch as catch can for you. You might hear about them, you might not. But if you get on board, we investigate a lot of different arenas. We support legislation on de-escalation of violence. We're going to have an Elizabeth Keckley Awards event in October honoring attorney Benjamin Crump and some other outstanding people, and you can be a part of that. And so we reach out to you and invite you to become part of our network. So thank you this evening, Dr. Hill. Really appreciate your participation, along with our other participants, Michelle Tedder, Jacqueline, thank you for your caregiver story. And Sarah, keep up the good work. And to all the rest of you, we appreciate it. And Diane, good session, good evening. So thank you all.
Thank
And
you.
hope to see you again. Diane, do you have anything you want to say?
No, I think you summarized it perfectly. It was very insightful. So thank you all for coming, and stay tuned.
Absolutely. Great. Thank you, Dr. Hill. Good
Right on.
Morehouse man. All right.
Thank you, Dr.
Good
Myers.
night.
Take care now.
Thank you,
Good
everyone.
night,
That's all.
everyone.
Good night. Thank you.
Good night.
Good night.